We tend to think of the knee as this fragile, kind of wobbly joint, right? But what if I told you it's actually one of the most brilliantly designed and surprisingly stable structures in the entire human body? Today, we're going to dig into the counterintuitive strength of the knee. So, to kick things off, let me ask you a question. We've got two major hinge joints in our limbs. One looks like it fits together like a perfect puzzle piece, while the other looks like two bones just kind of resting on top of each other. Which one do you think is actually tougher to dislocate? All right, here they are. On the right, you've got the elbow with that deep interlocking socket. And on the left, the knee, which looks, comparatively flat and a lot less secure. Your gut feeling is that the elbow is the clear winner for stability, but that feeling is completely wrong. And this is where we get to this really fascinating paradox. See, the elbow has that big, strong, bony block, the olecranon, that acts like a hard stop. The knee, it's got nothing like that. And yet, elbow dislocations are pretty common. A true, full-on knee dislocation, though, that's a rare and catastrophic event that usually takes a massive amount of force. So what's going on here? Well, it all comes down to two totally different strategies for managing force. The elbow relies on that single, rigid stopper. It's strong, sure, but when a force is too great, it just fails. It snaps. The knee, on the other hand, uses a whole system of distributed restraints. We're talking ligaments, capsules, muscles that all work together to progressively absorb and spread out that energy. There's a quote from our source material that just nails it. The knee behaves like a sophisticated shock absorber, not a rigid stop. That flexibility, that give, that's precisely where its incredible strength comes from. Okay, so here's the plan. We've just talked about that central paradox. Next step, we're going to dive into 3 specific scenarios: how the knee defends against hyperextension, how it braces for a major impact, and how it handles the balancing act of a squat. And then we'll wrap it all up by looking at the knee's secret teamwork. So that's our paradox. Why the so-called wobbly knee is actually stronger than the locked elbow. And the answer is all about a system working together versus just a single rigid part. All right, section 2, defense against hyperextension. So how does this shock absorber actually work in the real world? Let's start by looking at how it defends against hyperextension. The knee bending backwards way too far. The key thing to get here is that it's not one single structure doing all the work. It's a whole team of defenders. You can think of it like a series of shields, where each one engages in turn to absorb force and protect the joint from totally failing. And here's the play-by-play. First, the structures at the very back of the knee, that's the posterior complex, they engage. They're the first line of defense. If the force keeps coming, the big ligament columns like your ACL and PCL, they kick in as backup. And the whole time, the muscles all around the knee are firing, basically pre-tightening the whole system to take some of the strain off the ligaments. It's a progressive, really smart, layered defense. Okay, let's ramp things up. What happens when the knee has to brace for a much more violent force? This is the classic high-energy trauma you'd see in something like a car accident, and it really shows off the knee's sequential defense system under extreme pressure. The setup here is pretty simple to picture. The knee is bent, and bam, a powerful force drives the lower leg bone, the tibia, straight backward. This puts an absolutely insane amount of stress on every single structure that's holding that joint together. And just like we saw with hyperextension, the knee responds with a step-by-step defense. The first line to push back is the central column, with the super powerful posterior cruciate ligament, or PCL, doing most of the work. If that gives way, the posterior capsular complex engages, and if the force is truly huge, a third line, the collateral ligaments on the sides of the knee, are called into action. So here's the bottom line. For a true knee dislocation to actually happen in this situation, all 3 of those defensive lines have to fail. It takes a ridiculous amount of energy to break through all those layers, and that's exactly why this injury is so rare and so severe when it does happen. All right, we've seen how the knee deals with getting hit, but what about active, everyday movements? Let's take a look at the squat. This isn't about one big impact. This is about a constant, dynamic balancing act between some incredibly powerful forces. When you go down into a squat, you've got this trio of forces all working together to keep your knee from just buckling. Your muscles, the quads and hamstrings, are firing like crazy. Your ligaments, especially the PCL, are getting tight to stop your lower leg from sliding backwards. And the sheer force of your own body weight is creating this powerful compression, literally squeezing the joint together and making it more stable. Now, check this out because here's where it gets really clever. The role of your big quadriceps muscle isn't always the same. Its effect on your knee's stability changes dramatically depending on the angle of the joint. It's not just a simple engine, it's a smart, situation-dependent stabilizer. Let me break that down for you. In the first part of a squat, say from 30 to 60 degrees, the quad tendon is pulling almost straight up and down. It's not really trying to slide the bones around, it's mostly just compressing the joint, which is super stabilizing. But as you squat deeper, past 60 degrees, the angle changes, and the quad actually starts creating a backward pull. But, and this is the key, at the same time, it also creates a massive compressive force that completely overwhelms that little bit of shear, keeping the joint rock solid. And this chart just lays it all out. When you're deep in a squat, yeah, both the quads and the hamstrings are creating a little bit of a backward shearing force. But look at the compression column. For both muscles, it's huge. That's their main job here. They are primarily joint compressors, and that is the secret to stability in a deep squat.
Okay, let's tie all of this together now. The knee's secret teamwork. We've seen it defend against getting bent backward, withstand huge impacts, and dynamically balance all these forces during a squat. So what's the big takeaway from all this?
The big idea, the thing to really remember is this. The knee isn't strong because of one single thing, like the elbow's bony block. It's strong because it's a team. It's an intelligent, coordinated system where all the parts, ligaments, capsules, and muscles are constantly working together, adapting their roles depending on the specific situation and the forces they're up against. And that leaves us with one final question to think about. We started by comparing that rigid, locked elbow to the flexible knee. And I think the knee teaches us that real strength and resilience often don't come from being an immovable object, but from being an adaptive, responsive system. So what does real strength actually look like? A rigid lock or a responsive team? I think the answer is pretty clear.